this is. There we go. So that's live. See if anyone joins because it's the wrong. Let me see. It's the wrong stream for. Delete that one. Oh, I see. Yeah, I think because you have to have a software streaming service, and you can only set them up because of that. So that's why it does that. There's one person. Oh, 4 people.
Oh, good.
Some for others, but usually people join and flood in more as they come. But that sucks because they don't have the link is not there for the other one. That's okay.
But they'll still see it when they go to your page, right? Yeah.
So this will upload after we're done here. Then it uploads to YouTube, and then they can go back and click on it and then do the same thing.
But even if they come to your page, they'll see that you're live.
Yeah, now. I think so. I'll check.
Puerto Rico.
Hi, Laura.
Hi.
Thanks for joining. We'll get started in a few minutes. See if some more people hop on. Let's see.
Oh, Toronto. Canadians in the house.
Khadija, hello from Toronto. Glad to have you with us. Yeah, I think live it'll pop up for. Yeah. There we go. There we are.
That's weird.
It's a little delayed. Yeah. But
our dad's from Canada. Our dad's from Nova Scotia. So thanks for joining from Toronto.
Absolutely. Thanks for having us in your notifications. We'll get started soon with some questions. If you have any questions, type them in the chat below. And we can answer anything, medical, non-medical.
Hi, Laura.
Laura, hey.
My sister Laura's on. Come up with some good questions.
Yes.
Type them down below. We'll answer anything. Oh, Maine.
Maine, beautiful state.
Is it freezing up there right now? It's freezing here.
Yeah, we'll see for more people to come. So we also have a few questions that were pre-populated that we can answer for more people who watch the stream later and afterwards, but we'll give it a few more minutes and then do some introductions.
Yeah.
And then you guys obviously know me, but this is my sister, so we'll get started soon.
Oh, yeah. So our Marie from Maine said they're in the middle of a snowstorm. It's 12 degrees, but feels like -3.
That's awful.
Yeah, we can relate. It's not quite that cold here, but it's still pretty cold.
Yeah. Always cold.
And it's not, I mean, the snow is just not stopping. And we had a bunch of rain and ice last night, and now it's all snow and slippery. So it's cold.
The mix is what gets us.
Mm-hmm.
For sure. Yeah, Laura, or Marie, if you have questions, drop them below. Type them in the chat. We'll be getting started soon.
There's 5 people now. We'll probably do that. Nope, only 3.
Yeah, it'll
come and go,
fluctuate,
yeah.
Come and go a lot for what it is and what's happening. So
80 degrees.
Jealous.
I've always wanted to go to Puerto Rico. I think that would be so awesome to go visit there.
One day.
Yeah.
Yeah, one day. For sure. Yeah, all right. You want to get started for...
Oh, yeah. Thanks, Laura, for sharing it on Facebook.
Yeah. See if more people can log in and join.
Come on down. I will. We'll let you know. Puerto Rico's on my bucket list for sure. Looks like it's beautiful.
All right. You want to tell everyone who you are and
Yeah.
what you do? And because people already kind of know who I am.
Yeah, everybody knows Dr. Mitch. But I'm the other Dr. Rice. My name's Janice Rice, and I'm an emergency medicine physician. And I'm a medical director at a small emergency room in the Cleveland area. So I've been practicing for, showing my age, about 10 years. All in emergency medicine in all sorts of different types of hospitals, from level 1 trauma down to a standalone ER, everything in between. So I've seen a lot of things, inner city, suburbs. So any questions, just put them in the comments. We'd be happy to answer anything. I know Mitchell does a lot of COVID related issues. So if you have COVID questions, he's more of the expert on that. Clinical emergency room type of questions, I'm here to help you with that. So let us know.
Yeah, for sure. And hope you guys have good questions coming. Thanks, David. Yeah.
Thanks, David.
Thanks for joining us. For sure. Greetings, Dennis from Canada.
Yes, more Canadians.
Yes. We were just saying we are both half Canadian.
I'm full. Well, I was born
here.
here.
Technically were. You technically
but
are more than I am.
We have a different mom. And my mom and dad are both Canadian, and we share the same dad, who's from Nova Scotia. So we did have a question from R. Marie. Can AFib occur with a hiatal hernia flare-up?
That's a good question.
Really, I was born in. Oh, okay. So this is for R. Marie. I think what she's asking is, can a hiatal hernia flare up your AFib? Most definitely. Anything that is irritating the chest cavity, if you're somebody that has AFib, or even if you don't have AFib, it is something that could potentiate the AFib. So it's irritating the chest cavity. It can irritate the heart itself and the membranes and everything around the heart. And that can definitely trigger you into an AFib. Especially if you already have AFib, it's easier to be triggered. Yeah, so that's a good question.
For sure. Hey, Helen, thanks for joining us. Looks like Khadijah asked a question. Especially things going in the fridge. I heard the virus survives 2 years in the fridge.
So that's a COVID question.
Yeah, that's an interesting question. From what I've read and researched, Khadijah, there's no actual good literature or information that says that COVID can live for that long. Most viruses don't actually live very long without being in a host or infecting another human cell, which is the whole point of viruses. They need us in order to be able to reproduce and live, because they can't actually live on their own and do that. So I think you're totally fine with, you can definitely sanitize grocery stuff and wipe things down, wash your fruits and vegetables, which you should do anyway. But in terms of the virus living for that long, like in a freezer or a fridge or in colder type of environments, we just don't see any evidence of that. But that's a good question. For sure.
So David asks a question. How do you feel about cruise ships going maskless? It's tough to say. I am of the standpoint, do what you feel comfortable doing. If you feel comfortable wearing a mask, no shame in that. If you don't want to wear a mask, no shame in that. That even though the cruise ships if they are going maskless, they're still not going to prevent you from wearing one. So you could always, protect yourself a little bit more. Cruise ships are obviously close, tight quarters, and viruses spread very easily on cruise ships. So wearing a mask, if it's going to make you feel more comfortable, I say go for it.
Yeah, for sure. I think wearing a mask is never a bad option, no matter what you have. I think the CDC came out with a study a few weeks ago discussing how fast the virus will spread based on if you're wearing a mask or you're not wearing a mask, or what type of mask you're wearing. And in close quarters, like what a cruise ship is,
Mhm.
um, the virus without a mask could spread as quickly as a few minutes in a smaller room, especially in a dinner location. But if everyone has masks, or even if you're wearing masks, it could take a much longer time to do so. So I think that definitely wearing a mask would be, I think it'd be a good option, especially for cruise ships right
Yeah.
now. But
Yeah.
um, I'm sure there still probably would be quite a few people that decide to do so, even if they're maskless,
Yeah.
can take them
So,
off. So
yep.
what's the
If Omicron is less
mm,
severe, are vaccines still advisable for healthy individuals?
yeah, I think so. Omicron, as if you guys follow Dr. John Campbell too, he's one of the leading experts about COVID. He's always said that Omicron is the best vaccine available, like getting Omicron instead of being vaccinated, because it is so protective with the natural immunity that's been coming out. I still think they are advisable, especially, healthy is somewhat of a relative term where you could have a lot of underlying medical conditions like heart problems or high blood pressure or high, like hyperlipidemia, like high cholesterol levels that can still be considered risk factors for having worse outcomes with COVID. So even though the vaccines, again, they're not super, I don't want to say they're not good, but they're not amazing in preventing Omicron infection, but they do have significant T cell immunity, which I did a video on a couple months ago if you want to check that out. That does give adequate protection for worsening disease and keeping you out of the hospital. So I definitely still think they are worthwhile getting, so you don't show up in Janice's ER.
Yeah, we are over, the COVID coming in,
Hmm.
and it's just it gets hard to treat all the sick patients and all the hypoxic patients and everybody having issues with COVID. So get your vaccines. It's still going to help give some protection, but also, like Mitchell said, if you get Omicron, that is also the natural immunity is very protective as well.
Yes, for
So
sure.
that's good.
And I will say that through recent data that we've had, there the whole notion and concept of getting a vaccine for yourself or getting your children vaccine so the virus won't spread as much has been largely debunked. And so vaccinated kids can spread the virus just as easily as those who are non-vaccinated, as being asymptomatic carriers and being able to do that. So getting vaccinated is more protecting yourself rather than protecting loved ones or other people around you.
We had another
Was that?
question from Dennis.
Mhm.
Do asymptomatic COVID infections provide immunity against future infections?
Yes, they do, for
Mhm.
sure. From
No matter how you get the COVID,
Yep,
if you have COVID and you are very, very sick with it, you've mounted an immune response. If you
yeah,
have COVID and you're asymptomatic, your body has still mounted an immune response. It's seen it before and it will remember and protect you in the future against that infection, even if you're one of the lucky asymptomatic ones. So,
yes, for
yeah.
sure. And they do say sometimes that the severity of disease can be correlated with how much protection or antibodies you get. And so that's kind of like a general rule of thumb
Mhm.
that possibly you may not quite be as well protected, but there definitely is a level of protection that is very important, even if you get it asymptomatically. Did Laura write something?
Yeah,
Is
she
that
did.
it's a small font. It's hard
Yeah,
to see you
Laura.
from.
Um, oh. Are there any techniques that my 8-year-old can use to help fall asleep at night?
Hmm.
She has really been struggling lately and she hasn't been open to meditation type solutions. Well, first, and she followed up. We have tried reading and journaling, but so far nothing is really working well. Any other ideas? This is one that, well, obviously, because you're my sister, I can research it and help and get back to you a little bit more. There is something that I just bought for Cameron because my son struggles with going to sleep at night too. And I think it's called Mindful Kids or Mindfulness Kids. I saw it on Ellen and I bought it. And it's little flashcards that just help kids kind of get in the moment. It might be something like just closing your eyes and listening to the sound of the room and how does that make you feel, or writing something down, or look at this picture and what emotions is it invoking. Just centering your kids a little bit more because they have so much stimulation coming in at all times from phones and teachers and parents and all that kind of stuff. So maybe trying something like that. I know you said the meditative stuff doesn't work really well. Maybe she needs a little bit more time with it, or maybe different meditative stuff like flashcards or tapping. If you haven't heard of tapping, it's something that you can Google. It's really pretty easy to do. You tap on different sites, like on your head, on your hand. You tap on different sites of the body while you're saying repetitive things, and it can sort of help the anxiety sort of melt away on whatever is maybe keeping her brain super awake at that time. So those are a couple of little things that might be beneficial. The tapping and maybe some sort of flashcards instead of just trying to lay there and meditate silently. That might not be working for her.
Yeah, especially as a kid, I feel like that would be really hard
Yeah.
to do that.
It's hard for me when I try to meditate and I'm
Yeah,
like,
it's not an
okay,
easy
think
thing.
of like a golden ball. And then I'm like,
Yeah.
what do I have to do later? What am I doing tonight? So we get really distracted. It's hard to center in. So
Yeah, for sure. I think
a little bit more guided things might be
Yeah.
helpful.
definitely. I think too, as best you can to try to implement a bedtime, not even sort of a routine, but also the trying to go to bed in the same window to kind of get that circadian rhythm
Mhm.
normalized, if you will, that you can really get in the same like 30-45 minute window. That way, when that time comes most nights, it's like, all right, my body starts to get tired, wind down and do that. Obviously, kids' circadian rhythms are different than adults, but
I don't think they have them.
yeah, it's exactly.
Yeah, and it can be hard with all the activities to always stick to
For sure.
a
Oh, yeah.
specific bedtime,
Yeah.
but try the best you can and the same wake time in the morning.
Absolutely.
So
Yep. Yeah. To get that cycle.
good question, Laura.
It is.
There was another one. I don't know.
For polyethylene glycol allergy diagnosed
Is
2009
J&J a
anaphylaxis.
safer option?
So I'm actually not sure if J&J has polyethylene glycol in it, but if it does, I definitely wouldn't get it if you have diagnosed anaphylaxis to a substance or something that is in one of the vaccines. I definitely would talk to an allergist who would be much more adept and I guess competent in answering that kind of question. But if you can get any of the vaccines, there's newer vaccines coming out like Novavax that uses more traditional options that may or may not have PEG in it. So what is that? The flags, Poland. Greetings. Thanks for joining us. Is there a
Should have a reaction to Miralax before a scope. Thanks for your help.
gotcha?
Armory. Yeah, anytime.
Yeah, for sure.
Yeah, definitely check with an allergist
Yeah.
or a specialist anytime you are
Jim.
worried about.
Oh, this one's Jim.
Oh, from Jim. How do I find a life coach and what benefits could they provide for me? That's a good question.
That's a good question.
We both do life coaching. You can go first on this one.
Yeah, sure. For that. So I'll let Jan talk a little bit about kind of like what a life coach is. And I'll be doing a video on this in the future because I think it's really important. But being able to, in terms of finding one, they seem pretty much everywhere. If you Google life coaches or Google other areas in that topic within those areas, you can pretty much find a life coach anywhere or who claims to have the
Mhm.
capability and skills to enhance your life.
Mhm.
And I think that you definitely have to be careful because life coaching is not, it's not standardized. There's no federal laws
Mhm.
or global laws around who and who cannot be a life coach. So if you say, "Hey, I'm a life coach," anyone can kind of hang up a sign
Yeah.
and claim that title without actually, I don't want to say being trained per se, but just like doing the bits and pieces for that. And so
Yeah.
I would say Google search, probably friends of friends use life coaches or
Mhm.
know of people that are trying to do different things. And there's tons of different niches within the life coach itself. There's health and fitness coaches, there's mental health coaches, there's
Yeah.
tons, you name it.
It's so
It
vast.
is, and it's very diverse, but it's a cool up and coming field, I would say,
Yeah.
that's really up on the rise. So
And I think they might start to regulate it a little bit
I think
more.
so.
I think
Yeah.
that's on the horizon where you're going to have some sort of certificate or go through some sort of, there's a lot of different online courses out there if you want to become a life coach yourself. Um, and then just by searching on Instagram or I'm sure YouTube, TikTok, you can find life coaches that are maybe more like niche down to what you're specifically looking for. Is it just like diet and weight loss,
Hmm.
or is it what direction do I go with in my career, or is it more like parenting help? They're all out there, but you just have to be careful. Get some, references on their previous clients, stuff like that, to see who you might mesh with. And um, I always do a free call at first, like a free 10 or 15-minute call. Do we connect? Are you going to connect
Hmm.
with your coach? Because if you don't feel a connection and that you can be truthful and open and really honest with them, then it's not really going to work for either of you. So you can interview a few around, and that's helpful too. I use my own life coach. Her name's Justine Sloan. I will shout her out because she's
Hey, shout out
amazing.
Justine.
And you can find her on Instagram. She's awesome. And that's kind of how I got into it. I was like, wow, you really reach and help a lot of people. And that's how she sparked my interest on reaching people that way. But it's different than a therapist. So
Yeah, I was
a
gonna say
life
that.
coach can help you more with like direction in your life. Like, I'm kind of stuck. I need a little bit of direction and help and focus on getting from point A to point B, but there's all these things happening in my life. So they kind of break it down and help guide you there. Um, but whereas that's different than a licensed therapist or psychiatrist, psychologist, where they're more like diagnosing and treating underlying illnesses or ailments that might be getting in your way of functioning in the life that you want. So you might have underlying anxiety and depression or PTSD or bipolar or something like that, that a life coach isn't diagnosing and treating, but therapists, psychiatrists, psychologists can help you more with that. So that they're different in that aspect.
For sure. I think one of the big things that the differences between a life coach and like a therapist or even a counselor is a lot of times they will look at the past in order to see what is going on in the present, and life coaches really help you and all about future possibilities, so they grow and allow you to look at options that you have and how to kind of achieve the goals that you have no matter what they are, or how, you know, high or low of a goal that you may want to set for yourself. And they allow you, what I love about life coaching is when you work with someone, you're helping them find the solution on their own, if you will,
Yes.
rather than just spewing information at them. And I think
Yes.
that's really, it's about encouragement and empowerment and walking alongside them in the journey,
Mhm.
instead of just like, hey, you got 30 minutes and then all right, see you, see you later.
Yeah.
Go do whatever you need to. So
Yeah, you're not, a life coach isn't dictating at you what to
yes.
do.
Hmm.
They're giving you some other tools to maybe get there. So if you're having anxiety about making a choice, maybe you're going to either stay in the same job you're in or jump ship and change careers. So they're going to give you these tools of like visualization,
Hmm.
meditation, picture your life this way and then get into your body, picture your life this way. And like Mitchell said, kind of helping with you, but you're ultimately making the decisions.
Yes. Yeah.
So it is very empowering, and
Mhm.
from both ends. I've been in life coaching for many years now, being coached myself by Justine, and it's empowering from that end. And then when you're on the other end reaching those people, it's really empowering from that end as well.
Yeah, for sure. Also, shout out for anyone who drinks LaCroix. Do you like the limoncello flavor? Leave a comment down below, because I've had a lot of polarizing views on that. But I think
haven't tried that one.
A couple up
Hi, Sela.
here that.
Hi.
Hello, Lisa Bauer. Let me see. I think David had it yet. How long do you think the booster will last? That is very difficult to say right now. Preliminary evidence shows that even the second shot lasted about 4 to 6 months, and we saw a lot of waning immunity. It's probably in the ballpark of that same 4 to 6 month window, but everyone reacts differently to different vaccines. No one is guaranteed a certain degree of threshold, but the bottom line is we just don't know right now how effective that third shot will be. Israel was doing those fourth shots, and we did see kind of the law of diminishing returns, where the total antibodies that were received from the fourth shot wasn't even as high as the second or the third shot. So my guess is it's probably around that half-year mark before it really starts declining in overall immunity. I think there was one. Oh yeah, do animals?
Oh yeah, cats, dogs, parrots carry the virus.
Majabine. So
yeah, Majabine.
Yeah, Majabine asked, "Do animals, for example, cats, dog, parrots, carry virus, and can they transfer it to humans?" I don't know what you've heard about this, but some of the stuff that I've read and seen is there was a couple of studies showing that cats did carry COVID. In general, they absolutely can, and there's bajillion viruses that
can be
cause
transferred
from animals.
Humans, especially a lot of birds carry viruses, and rats and mice, and you know, and it can be very easily transmitted between human and animal. Now, COVID specifically, I don't know how many studies are out there.
There's not many specifically for COVID, but they did find earlier on last year that house animals could transfer. I don't even know if transfer is the right word, but
they could be a vector.
Yes, they could kind of be a vector, and it's basically what that means is like the virus can be attached to like an animal, and then that way it's exposed kind of to you in the household. But I don't know if they directly can get COVID and then give it to, you know what I mean?
Yeah.
So
I just don't really know.
Yeah.
I saw another one that was maybe a little more ER related.
Yeah.
R. Marie said, my husband wants me to ask if his sleep apnea is considered a comorbidity, and if oxygen levels run lower in someone who has sleep apnea. And the answer is yes. If you have sleep apnea, basically sleep apnea is when you sleep, usually you're on your back, the airway relaxes and it kind of collapses back. That's people that snore very loudly and things like that. So when you have somebody that has severe sleep apnea, they can actually stop breathing at night, and their oxygen levels and typically their heart rate drop a lot lower. So you can have somebody who drops down into like the 80s on their oxygen levels, whereas you want to be in 99 to 100% on your oxygen levels. And to me, this would be a risk factor if you have COVID and you have sleep apnea. You're already putting stress on the heart and lungs, especially at night. So if you don't have a CPAP or a BiPAP or some sort of supportive medical equipment, you really need to get some sleep studies done and look into that.
Yes, ditto, for sure. Yeah, we're like squinting at the.
I'm not that old, but the print is tiny. So when we come this close, it just means we're reading it.
So Janice Lauren said, "I had the booster back in October. Should I get the second booster in March? I'm over 65, 25 pounds overweight, is that considered obese? Two of my friends already got the second booster. For being 25 pounds overweight, we really go off BMIs, which are body mass index, which is kind of a poor indication of overall weight status, if you will. But in order to know that, we'd have to know your height.
Your
And
height.
so
Mhm.
being 25 pounds overweight depends how much you weigh and depends how tall you are.
Yeah.
But I would say second booster shots, there's not a lot of data that we have so far about how good they actually are. And so if I were you, I would kind of hold off on getting a second booster shot, especially when having the booster back in October. um, if I were you, I would hold off to see just how the FDA or other studies that come out with overall levels. Because, like we said before, the fourth shots in Israel that came out actually gave a less responsive antibodies than even the second shot of a Pfizer or a Moderna. So, if I were you, I personally would wait until there's more information about it.
Yeah.
What other questions you got for
We had a
Alisik?
kind of
Penis? Do you believe a second booster would be necessary? Um, it's hard to say. Kind of what we just kind of talked about that a little bit. It's hard to say if it really would be necessary or not. I think there's a sweet spot of that law of diminishing returns where you can't just keep jabbing someone with vaccines, the antibody. The body's not going to respond appropriately with the antibody production. And so it might become a thing, but I think with COVID being endemic starting maybe as early as the spring, which the way things have been trending, they might not be useful. They may not be needed, and or it may be like a yearly
Yeah,
shot.
like a flu shot.
Yeah,
You just get your
exactly.
flu shot, your COVID shot for the
Yep.
year.
hmm
They try to guess and imitate the strain that it's going to be as best as possible,
Yep.
but it's probably going to turn into you get your flu shot, you get your COVID shot. My guess is once a year, like Mitchell said,
Yeah.
but
hmm
I don't know for sure. That's just an educated guess. Unpopular opinion said, I have COVID and it's giving me digestive issues more than any other symptom. Is that normal? Yes, very normal. I feel like, at least from the standpoint, when I see patients come into the ER, they seem to sort of fit into a few different categories. I see patients that have respiratory symptoms mainly, like high heart rate, tight breathing, cough, wheeze, or I see people that have like headache, body aches, like every joint aches, and fatigue. And then I see people that have a ton of diarrhea. They just come in because
Mm.
diarrhea all day, and their potassium levels actually drop. So if you feel like you're having a lot of diarrhea, it can be a COVID symptom. And too much diarrhea can cause your body to lose a lot of potassium, which can cause some cardiac issues. So if you've been having diarrhea for a while and feel like you can't replace everything that's coming out by eating and drinking enough, then you should get everything checked. But digestive issues are a big COVID symptom.
Absolutely, for sure. SoCal friend, how's Israel doing? They're doing okay. They're doing better than they were before, even though they have a lot of doses that could be almost the entire population vaccinated. There is dispute on what percentage of the population is vaccinated, but they're doing better than they were even a month ago, which is awesome. So what
There was Hugh. I'm not going to say his name out loud. You know who you are. I do a lot of running, and one foot seems to blister more than the other. Is this normal? And how do I deal with this? That's actually very normal. Almost every person in the entire world has one leg that's longer than the other.
Mhm.
So everybody's gait can be a little bit off, which means when you're running, one foot is going to hit the ground harder and a little more off balance and a little earlier than your other foot if you have that longer leg. So that's definitely something to look into. It could be the way you hold your foot, it's hard to say without knowing exactly like where the blisters are and things like that. But if it's just on one foot, you could be rotating your foot in or out. It could be that you have a longer leg on that side, things like that. So you can go see an osteopathic physician. They're very good at the specializing in OMT. They are very good at looking at your body alignment. Chiropractors, podiatrists, they all will look at those things. And if your leg length is off a lot, which could be causing the problem, you can get a lift for your shoe and it should even everything out.
Yeah, for sure. Most people do have different size feet slightly.
Yeah,
as
also
well.
different size feet. So you might need a size 7 and a size 8 or, and have 2 different total shoes.
Big floppy shoes.
Yeah, just don't trip.
I don't know who Harold Shipman is.
I don't either, but I was afraid to say that in case they'd be like, you're dumb.
No. So I can't answer that. Sorry.
Yeah, I don't know who that is.
Sorry, Mr. Ness.
Yeah, Mr. Ness.
What is going on with Novavax? Any update on approval in the U.S.? Yeah, that it's shown. So Novavax, for those of you who don't know, I'll be doing a video on this in like a week or two. But it's a vaccine that uses a little bit of older technology, but the data that we have on it isn't super amazing. It's kind of like Sinopharm or Sinovac, if you guys are familiar with those. The overall efficacy is somewhere in the 60-some% range, but the data was done so long ago when Omicron wasn't a thing. So it's hard to say, but in terms of approval in the US, they did say hopefully by April, sometime in the mid-April or at the end of April, but potentially as late as summer. So that's kind of the update on that. What other questions we had for?
I think we looked at most of them. This one.
If the antigen test is positive, does that mean you're contagious? How long will it take for taking that? So unpopular opinion. Video on this coming out Sunday, actually. So
nice.
If you test positive for COVID, it does not mean that you're contagious. So the contagious period lasts typically 3 to 8 days from when you first get the virus, which doesn't show up to being positive for up to sometimes 48 or more hours later. So typically, if you test positive and you've had symptoms for a couple days, you're most likely contagious. But on rapid tests, you can test positive for up to 2 weeks after symptoms resolved. So if it's within, I would say, about a week of having symptoms, you're most likely contagious. Outside of that, even if you still test positive again, you're not contagious. And they don't want you to test again after being positive because the whole quarantine guidelines is based only on symptom, like if you're symptomatic or not after the 5 days, rather than testing positive because you can test positive for so long.
Yeah.
What else? I have COVID.
That was.
Okay. That's the other unpopular.
I don't know if you did this one, but I don't know much about that. That would be more you.
About CDC didn't publishing large. So LASIK.
Hi, Eric.
Eric, he was on here last time too. Tuning in.
Eric is our cousin and amazing pastor at the chapel here in Sandusky. And he just popped on to ask, we have a big family dinner tonight. And he said, will you guys both be eating spaghetti tonight? And yes, we will. Well, yes. I'm kind of doing low carb. So I brought zucchini noodles to do with my dad's. I know. He's probably going to be putting a puke face in the comments soon.
That's hilarious.
But yes, we'll see you soon. And we'll be eating lots of spaghetti. My dad makes a special sauce.
So LASIK Bowers question. What do you think about the news from, you know what? What is it?
They want us to play a duet on the piano.
All right, let's do it.
Maybe chopsticks.
Yeah. CDC not publishing large portions of the COVID data. So I actually don't know and I'm not familiar with the data that was omitted. So I will have to do more research and get back to you on that for sure.
Yeah, and I have no
So
idea
I'm
about
not
that
as
question.
familiar with that
Yeah,
right now.
I can't. Yeah.
Are you Italian?
Oh, yes, Laura, I did mean to address that question. Adrian asked above about what to do for anxiety. I
I didn't
did
even see
mean
that.
to go back and look at that one.
Adrian Louise, for what are some things you do
Oh,
for
yeah.
anxiety,
Yeah.
feeling anxious apart from medications? That's a good one. It's a
Yeah,
really
that is a good one. And I
Yeah.
meant to circle back on that one. Sorry,
You
I
want to
missed it.
take some
Yeah,
thing
sure.
for them?
So I talked a little bit about this when I was
Mhm.
answering Laura's question about helping your kids sleep. But it depends on, is this just acute anxiety? Is this a long-term anxiety? And
That's a good
also
point.
going back to life coach versus an actual
Mhm.
therapist or psychologist or psychiatrist, what kind of help do you really need? But if it's just sort of more acute, or you're dealing with some sort of issue that's bringing up a lot of anxiety in your life and you just kind of need to calm down, personally, I use my life coach. She gives me a lot of tools like tapping. I had talked about tapping earlier in this video, EFT tapping. You can Google that, and you tap on different sites of the body to help your anxiety. You tap on the forehead, the temple, and other sites on the body. So tapping is something that helps. Journaling, get all your anxious thoughts down on
Absolutely.
paper.
Yeah, it's a big one.
Doing a brain dump. I sometimes like to do a brain
Mhm.
dump. And
Yep.
and when I'm journaling, I like to journal some positive affirmations. So you're keeping positive energy in and sort of getting that negative stuff worked out. I do have on my YouTube page, I'm posting podcasts. They're only about 10 minutes, so you can listen to it while you drive or whatever. But I do go over this. I go over meditation, I go over journaling, I go over positive affirmations and kind of how to incorporate them into your life. So if you want to check out my page too for a little bit more in depth, because we don't have time to go over everything that can help you with your anxiety right now. But those are some things. And guided meditation is another thing that I love to do. I actually use my Peloton app. But there's free ones on YouTube. You can find them everywhere. But I love Ross Rayburn on my Peloton app. He does very good guided meditations, whether you want a relaxing one, an energizing one, a sleep one. And I think those help with anxiety, as well as breathing techniques. There's a million
Mhm.
breathing techniques out there. Controlling our breath is one of the biggest ways to help control your anxiety and your emotions. So those are some quick tips, anxiety topic to cover, but hopefully that gives you a little bit of tools to start with.
Yeah, for sure. Those are all really, really good things. And we will link your page and Instagram and everything. It'll be in the description of the video, and then we'll put it in a comment section too, so you can go back and click on it on the links directly.
Thanks.
As well.
Mitchell's much better at YouTube. I just started doing YouTube, so my videos are not fancy. I'm better on Instagram, and some TikTok stuff, but my YouTube is not fancy, so don't expect much.
Other anxiety stuff in terms of like supplements and stuff that you can take, some easier quick fixes. There's a lot of essential oils and things that you can do.
Mm-hmm.
Usually people feel calmer with lavender smells, things like that, as well as something that I recently stumbled upon is drinking lemon balm herbal tea is really good. And there's actually some most of the herbal and supplement stuff, there's not a lot of information in like hard science data out there for that. But with lemon balm, there actually is quite significant data in terms of allowing yourself to relax and being able to sleep. A lot of anxiety can stem from if you're overworked and overstressed and you have being spread too thin and kind of burning the candle at both ends can really
Which all of us
promote
do.
a lot of anxiety. And so making sure you're able to get sleep, restful sleep as well. And that can, herbal teas, mint tea can help, but especially lemon balm, I would definitely check that out because it's easy. It's a cup a day and mixed with all the other techniques that Jan was talking about can be really, really helpful.
Yeah, well, maybe we'll get some more videos out on anxiety because it's such a big topic.
Yeah, it's huge.
And everybody needs help with it. Everybody is anxious at some level.
Yes.
And everybody's overworked and spread too thin. So we'll try to definitely like
Mm-hmm.
zero in and get you some more information on that.
Yeah, and it's how much of disease in the world is due to stress and anxiety. That's something we don't even know, for sure. But what it plays, it makes any medical condition worse that you may or may not have. So
let's see.
Some other ones for, are you Italian, David? No, neither of us are Italian.
Not Italian.
But I've gotten that a lot in my life. Have you gotten asked that for?
I have not.
I have a lot.
You're a lot darker.
Than
me from Brenda, because we have separate moms.
Yep.
So no, I am Canadian, English, and Irish.
Pretty sure I'm the same. Technically,
Jewish.
Yeah, Jewish. I say I'm Jewish because I'm not actually Jewish, but my mom's Jewish.
Yeah.
So technically, I'm Jewish, but I just say it's an ish thing.
Yeah. So, not Italian.
What else you got from?
Well, you did mention pasta night. That is true. My dad makes.
Good point.
My dad can cook on the grill and stuff, but really he doesn't make a lot of things homemade. He has a stuffing at Thanksgiving and he does a pasta sauce. So he's Canadian. So I don't know. He's not Italian, but I now see the correlation with the pasta night.
That makes a lot of sense.
Yeah.
Makes a lot of sense. Yep. Janice, thank you for joining us. I'm glad you're able to to be with us on the stream and we can answer your question.
Yeah.
It's awesome. Let's see what else for. Since I have several things diagnosed: my back spondylitis, general problems. I can't remember exact terms. Can things like this turn into cancer? I have an aunt die from back cancer. You want to answer for?
I don't really know because it's hard. It's hard to say sometimes if we don't know exactly what your issues are. So, but the things you listed don't necessarily turn into cancer. But what is the underlying issue? Is there an autoimmune disease? Is there, is there just a strong genetic component of cancer in your family tree? But necessarily these specific disease processes turning into cancer, I don't know if it would be true.
Yeah, for sure.
You think? Okay.
Yeah, I think that it's important to, like Jan was saying, figure out the underlying cause, because whatever is causing those things could possibly lead to that. But spondylitis and degenerative joint or back issues themselves do not lead to cancer on their own.
Right.
Like it doesn't go from degenerative back to back cancer or cancer of the spinal cord of some sort.
And typically, if you're getting a cancer into your back, generally that type of cancer comes from somewhere else.
Yes, exactly.
It's going to, in males, this is the easiest example.
Yeah.
An older male might get prostate cancer, and that can easily spread into the spine because of proximity and where the lymphatic chains are and everything.
Yep.
But those specific diseases don't just flip into cancer, but there could be other things that cause cancer in your spine.
Exactly.
Hopefully that helps.
Let's see, are there any other questions for, since I'm having mostly digestion problems with COVID, do I still need to worry about respiratory issues happening?
Oh, that's a good question.
I'm on day 6.
So that was unpopular opinion. The one with, I think unpopular opinion has a lot of diarrhea right now. And he wants to know if it's going to change in the respiratory symptoms. And you're more of the COVID guru. I feel like I'd said earlier, patients kind of stay within whatever category they're in. If they have respiratory issues from COVID, that's kind of what they present with and kind of what they deal with. If they have more digestive issues, they don't get quite as severe respiratory issues. That's what I've been seeing like in live clinical practice. Certainly COVID at all can affect the respiratory tract. So you could have diarrhea and then also develop a cough. You're on day 6. I would expect a cough by now, or tight breathing if you're going to get that. But it's hard to say. What do you think?
Yeah, exactly right. Accurate? I think being on day 6, not having respiratory symptoms, it's unlikely that those would develop by now. Like we said, they can, but try not to think about it. I know it's easier said than done, but if you think about having breathing problems, anything we tend to focus on, we can manifest those things to come true based on just the overall idea of
From
having
anxiety.
something from anxiety. Exactly. It stems and it can wreak havoc physically.
Yeah.
Even without, and that's the crazy part too, is people say that the mind and body aren't connected, which both of us being DOs, not MDs, but DOs, that we focus on, as you were saying, the whole body picture. The mind and body are so interconnected. It's crazy. And even from the last dementia video that I put out on Wednesday, if you guys haven't seen that, check that out. But the vagus nerve is one of the cranial nerves that connects your stomach to your brain, and almost all the serotonin in your body, which is the hormone or neurotransmitter that makes you feel happy. We all hear the serotonin, increased serotonin makes you happier, is made in the gut and transfers to the mind. So everything is connected and interconnected is kind of the point.
Yeah,
that I'm
definitely.
making. So
Yeah, definitely. Unpopular opinion. Thank you for answering my questions. Of course.
yes,
Anytime.
absolutely.
Thanks for joining us on the live. We didn't know if we would have 0 people.
I know.
One person, 2 people. So thanks for being here and being interactive.
Seriously, you guys are awesome.
Yeah, and these have been awesome questions. I've really enjoyed the questions that you guys brought to the table here. So
Absolutely.
That's good.
David Locke, do you have any children? I do not. I'm not married, no children, but
I have 2 children. I have a 2-year-old girl named Kate, and she is literally my twin. She is a mini me.
That is
super
true.
Cute. I'm biased, but she's super cute. And then a 5-year-old boy, Cameron, and he is a wild man, boy, just bouncing off the walls, all the time. So my life is pretty hectic as far as having 2 kids and working full time in the ER and being the medical director. But if I'm not busy, I'm bored. So I like it.
That's so true. So true. How nice. Awesome. Appreciate
Armory, I appreciate it. Have a wonderful dinner. Thank you. We will probably eat too much.
Oh yeah, absolutely.
It's
always.
So good.
But it is delicious. So
Dr. Mitch is next for kids.
Yeah, I don't know about that, David. I gotta find someone to make that happen with first. So
that won't be tough. But he's an awesome uncle, so I know he'll be a wonderful dad.
Thanks, Jan.
Yeah,
means a lot. Wow.
Yeah.
Sentiment and real on this live stream.
I have a tear. I have a tear coming. Fight it.
Cueing the tears afterwards to let the Adrian asked about. Do we have any other questions that we haven't?
I don't think we missed any in the chat. If we did, feel free to
Yes.
Oh wait.
Leave another one down below. Mike Oxmalt said, "Do you think
these names?
I love it. Do you think there'll be another pandemic anytime soon? Not COVID, but something similar like Ebola." Well, I hope it's not Ebola.
I would panic.
Yeah.
Okay, so when Ebola back in 2013-ish was kind of they were like, "Oh, we're gonna have an Ebola outbreak." So if you guys have not read this book, I don't know, maybe you should, maybe you shouldn't. It's called The Hot Zone. It
I never read it.
Terrifying. It's all about how Ebola started and how it transmitted from basically monkeys and primates over to humans. And Ebola is so scary. So I hope we don't have a pandemic with Ebola. It basically liquefies you from the inside out and you bleed out of all of your orifices. So it's really wonderful.
Yeah, wonderful.
But will there be another pandemic anytime soon? I don't know about soon, but it's bound to happen again.
Yeah.
I mean, will it be in our lifetime? I don't know.
It's hard to say.
Now, specifically talking about Ebola, typically your less deadly viruses are your more virulent viruses. So the Omicron spread like crazy because it was less intense. because the virus does not want to kill its
Right.
host. The
Mhm.
virus wants to keep living too. So they don't really want to kill us. They just want to like hang out for a little,
Yeah.
make us feel like crap, and then like move on. So it's less likely to be the deadly ones that spread super wide. But again, I mean, it can happen with any type of virus. And there, as you've all witnessed over the past few years, it's
Mhm.
impossible to stop the spread of a virus. It's
Impossible.
like impossible.
Impossible.
Unless we all agree to hibernate for like 2 months.
Yep. Which is
That's never going to happen.
it's never gonna happen. It's not reality. The whole world would shut down. So
Mason says hi. Did we say hi to Mason back? Hi, Mason.
yeah, I still will. Thanks, David. I think that's a compliment.
Mason's bad allergies. He's got dark circles under his eyes. Anything I can do for them?
Yes, I have a video on that, Laura. Actually,
He's basically
dark
calling
eye
you out,
circles.
sister, that you have not watched all his videos.
Yeah, every single one. There's
Click
only
on it.
there's only 118. So
Well, you better get. You're stuck inside anyway. Go watch the videos.
yeah, but seriously, one of the best things you can do for the under eye circles is take cold spoons, freeze them, and then place them on your eyes for 5 minutes different times in a day. If Mason will sit there with cold spoons on his eyes.
I was just going to ask, do you think Mason
Probably not.
will sit
Probably
there
not.
with cold spoons and eyes closed?
That would be difficult. But also, brewed green tea bags are also, like, as cheesy as it sounds, it works really, really well.
Yeah.
And so if you can sit them down and do a combination of the two with the green tea with a little bit of caffeine to
can
help
we
it through.
picture Mason doing that?
No, we can't.
I can picture him throwing like a panic fit about it.
Yes.
I can.
Yes.
And the reason these things work is because they help vasoconstrict.
Right.
So you're getting congestion around the
Mhm.
capillaries and everything around the eyes. Your skin is so thin here that your vascular system is just much more like visible, kind of, if that makes
Yep.
sense. So things like tea and cold,
Mhm.
you place them on the areas and it vasoconstricts, so everything kind of shrinks down.
For sure. Also, not for Mason, but in general, reducing the amount of caffeine that you drink, because being dehydrated and or drinking more water
Mhm.
will help reduce the vasodilation that you see with those capillaries under your eyes. And so staying hydrated, making sure you get the fluids to kind of flush everything through your body can
And
help
not
that.
too much salt.
Yes.
If you eat too much
Yes.
salt, like when I get salted up,
Oh yeah.
my family makes fun of me. If I have too much salt,
Yeah.
I
Yep.
wake up in the morning and I can barely open my eyes or bend my fingers.
Barely open the eyes.
Barely. It's like they're swollen shut because the salt holds onto water and makes your eyes
Yep.
and your fingers really, really puffy.
Yep.
So don't get salted up.
Don't get salted up.
Mm-mm.
We don't want salty people.
Would you recommend drinking coffee prior to a run?
Interesting. Yeah.
So I personally like coffee as a pre-workout. I don't like pre-workout that has a lot of stuff in it, and
Mhm.
coffee is very natural. So sometimes if I know I have a more intense lift or boot camp workout or something like that, then I will have a cup of coffee before I go, because it just kind of is a natural stimulant without getting into the like all the chemical stuff.
junk.
Yeah,
Yeah.
the junk that is out there for pre-workouts. So if you feel like you kind of need a little more energy before you run, then I think coffee is a good way to go.
Yeah, I would definitely agree with that. And make sure to not drink too much coffee before, because caffeine, especially when your heart is beating very quickly, can cause heart problems and
yeah.
arrhythmias,
Arrhythmias,
fancy
yeah.
word that we use,
You're welcome.
especially with all of that. So I think a little bit of caffeine's good, but
Yeah,
if you
but definitely not too
slam,
much.
yeah, like 6 cups and then try to go run laps, like that's
And,
not good. It's
yeah.
not healthy for you.
Yeah,
Not good
because
for
you
your
can
heart.
get into these tachycardic or really high heart rate things that you sometimes you'll end up in the hospital
Yeah.
having to fix. So
Yep.
I'm saying like a cup of coffee or a half calf is all I do before I go work out.
Yes.
And I don't even do it every time. But I think it's better than like a big monster or those really
Yes.
like junky pre-workout things
Yeah, and
that have a ton of stimulants.
exactly.
A
Yeah, I
ton.
was gonna say it's not even just caffeine stimulants. You add in other stimulants on top of like they have sometimes 100, 200 milligrams of caffeine, which is a lot to take at once. That's part of the danger of what the fad of dry scooping
Yeah.
that was is that it just goes straight into your bloodstream very quickly, and that's overwhelms your heart and your body in that way. So what other questions?
Unpopular opinion has one more question. I have a
Mhm.
4-month-old and I'm isolated. When can I hold my baby?
So isolated, having COVID, you know, it's hard to say. It depends on how many days you've been isolated for and how many days you've had symptoms. Are you still having symptoms? Kind of need a little bit more information to figure that out. But I will say that if you are symptom free after 5 days, that would be fine. You wouldn't be infectious anymore in order to worry about spreading it to your 4 month old.
Yeah, when I had COVID personally, as a single mom home with a 2-year-old and a 5-year-old, I didn't really have a choice. I couldn't isolate from them because obviously I still have to take care of them. And my thought process was before I even realized I had COVID, I was all over them and with them. So they're kind of going to get it if they're going to get it. So if you were with your 4-month-old all the way leading up until you realized you got symptoms and then got a positive test, they were probably already very exposed.
Probably.
They might even have it and be asymptomatic. So if you were already around them almost the entire time, there's kind of no point to isolating
For sure.
at that point.
Yeah. And
But if you were able to stay away, then the 5-day thing of symptom free
and
is good.
remembering, guys, that when you get COVID, even when you have symptoms, you've been infectious already for about 48 hours until before symptoms even come up. So that's why it's so hard with all of these statistics to backtrack and isolate and all of this stuff. But knowing that if you've, like Jan was saying, if you've been around your child before then anyway, probably may or may not have it, and the chances are very high because it is a virus and can't be stopped anyway. For that.
So I have a question more directed for Mitchell that I pulled over from my Instagram page for one of my friends that couldn't be on, but we'll put it out there for everybody. Have you heard of anyone being reinfected with COVID very quickly, like within a few weeks?
Within a few weeks, yeah, that's a good question. I think for back when Delta and Omicron were around, you could be infected with one variant and then another, but with Omicron being the dominant strain, it's I don't want to say it's impossible, but it's because that's a strong word, but very, very, very unlikely to be reinfected within a 3-week window. And it's actually even getting Omicron once to be reinfected with Omicron again is very, very low. I think I actually just recently read something that the chances of that happening are about 1 in 40,000. And putting the number in perspective, every time you drive, you have like a 1 in 105 or 110 chance of being in a car crash. So it's way, way significantly less chances of getting reinfected twice.
Brenda's on. She said, how about having the other Dr. Rice? We have Dr. Rice, the other Dr. Rice, and there's another Dr. Rice, our dad. How about having dad on to answer some urological questions?
Yep, we should do that. We should do a family live stream at some point.
Laura is a PharmD, and she can answer all your pharmacological questions.
Drugs for days.
She's got all your answers.
For sure.
Have you both had COVID and how long did it last? Yes, I had COVID back in September. I'm assuming that I had the Delta variant. That's kind of when I got it, was the peak of Delta. And it was right before the boosters were available to healthcare workers. So I was kind of in that window where my initial 2 vaccines had worn off and the booster wasn't there yet. And that's when I got it. I was kind of sick for a full 10 days. and lost my sense of smell and taste. And some things still smell off to me, still.
Yeah.
Which is annoying because I like eggs, but every time I make eggs, it smells like there's blood in them.
Oh my gosh, it's terrible.
I know, it's terrible.
I didn't know that.
Yeah, so
Jeez.
but mostly I've fully recovered, but there's some things that still have a weird
In the chef.
sense. Yes.
That's funny.
Obviously our dad is the real OG. He knows everything about medicine. He was a family
Been around
doctor
for a long time.
He'll tell you all about it if you give him time. He was a family doctor in Nova Scotia in a small town. Then he went back to residency at McGill in Montreal and did became a urologist. So that's where he does urology training. So we will definitely do another live and have him on here.
That'd be fun.
And we could do a live with our other sister who's a pharmacist and have her on here for any drug related questions.
We should have to stop him from rambling
about
stories.
Brenda, if Brenda is still on, you will. My dad really likes to talk. Well, some may call it rambling.
Yes. It's rambling.
It's rambling.
It's rambling.
So we will have to have stop points for him or he'll just keep going.
Right.
But
exactly.
yes, we want him to be.
Yes, we do, for sure. I also had COVID back over Christmas.
You didn't answer that.
It was not fun. I'm pretty sure I had Omicron just based on symptoms, but I also lost my taste and smell for a while. And my smell is pretty much back. My taste is probably 80% of what it normally is still. And that was about a couple months ago. And most of the things are back, but different flavors that I used to be able to taste are a little bit more bland than they used to be. But I'm sure just over time, it'll.
Do your eggs taste like blood?
They don't, which is good because I eat eggs a lot. So.
And I actually got super frustrated with the smell thing because I use my smell in the ER to diagnose people a lot. Like a DKA patient has a specific smell, or like a rotting foot has a specific smell, or a GI bleed, or C. diff. Like there's all these things that even though it's kind of gross, like I realized when I lost my smell that I use my smell a lot in the ER to diagnose and treat people. So I was like, I hope it comes back.
Glad it did.
How about garlic? Did you have any issues with tasting garlic?
No.
After?
I don't. No, garlic's fine for me. I don't know about for you.
Yeah, it's fine.
Still
and did you get brain fog? Good. I did. Yeah. I went back to work after the 10 days off, and I specifically remember trying to chart and just kind of being like, wait, what was I writing? What was I doing? And I just felt like I was kind of moving through mud while I was trying to see patients where I'm normally like really fast. So that was annoying. So did you get dizzy?
A lot of dizziness. I have a lot of dizzy problems before, which I kind of talked about on the first stream a little bit. And I'll probably go into detail more in the future, but the dizziness really affected me for a few weeks for me personally, but I know most people, it's like a few days that they really get even some true vertigo, which is like the room spinning, and also feeling like that imbalance where you're kind of walking on like marshmallows and things just aren't quite still. But Omicron is very, very known to do that. And that's kind of why another reason why I thought that it was Omicron more so than the Delta variant.
Yeah, they can affect the vestibular system a lot more.
Yeah.
So I didn't have dizziness. I just felt a little lightheaded, more like fatigue and lightheaded, but not vertigo, thankfully, because it's, as Mitchell knows, it's terrible.
Yeah, for sure. For sure. Are there any other questions that
I think we got most of them.
Yeah, I think so
Almost all questions. Sorry if we did miss any questions, but some of them come through rapidly.
If you have questions, type them in the chat. We're here for probably another 10, 15 minutes or so to answer any and all questions.
It's been a little over an hour, and you guys have just been keeping us going. So thank you. And hopefully you're not bored of us yet.
If they are, they leave the chat. We'd see the number
just declining.
Yeah.
And
they're
still hanging out.
Yeah.
So that's good.
Hanging out, having a good time, which is always good. I know there was other questions from your Instagram.
Yeah.
Gina, you're welcome. Thanks for joining us. Thanks for asking questions too and being a part of the chat. We love having everyone. So another question that I think you want to answer that. You want to do
So, yeah, somebody had
Yeah.
asked, why do cold sores pop up around the mouth and the chin?
It's a good one because it's very common.
Very common.
Yeah.
So, it's typically cold sores are from a type of herpes virus. Now, when I tell my patients
Got
that
the
they have
herpes.
herpes, they freak out. But there's different types of herpes. There are many, many, many strains of herpes.
Yes.
And it can cause anything from shingles to cold sores to genital herpes to chicken pox. They're just all different strains of the same type of virus. So when you get cold sores around your mouth and lips, it's most likely the herpes simplex virus type 1. And this is a virus, so it can attack the nerves in a certain area and it can lay dormant and then pop back up. Most people see it when they get stressed or if they go through something traumatic, or maybe they just like gave birth and then they might get cold sores, or they just had a virus of some other kind and then it pops up. So you can get them on and on throughout your life. But typically, once you've been infected with the herpes virus, the outbreaks get less and less over time, which is good because it can be very painful. So if you do have a cold sore or something of that nature around the mouth or genital herpes, or you're worried that it's that, go into the ER or go in with your family doctor or your OBGYN and get checked out, because there are medications that we can put you on that decrease the length and help with the pain and all those types of things. And then some people, if you get it a lot, you're on something like a Valtrex daily to suppress any future outbreaks. So
Absolutely. The loss of That's sad, David. Sorry to hear for whoever that you lost, that was a loved one. That's so difficult to deal with and to have. And so we're definitely sorry to hear that.
And you said you learn it never goes away. Do you just learn to live with it? And, I just think that takes a lot of self-reflection and self-work. And, I can't speak for you, but you don't want them to go away, but you need to remember them in healthy ways, I guess I would say.
For sure.
So getting into therapy or, working on tools with anxiety or processing grief, there's so many grief counselors out there that can help you. And like I said, I don't think that you want them to go away, but you want to be able to carry them with you in a healthy manner.
Yeah, absolutely. The best description I've ever heard about grief is the analogy of a box with a ball in it. And in the box, there's a button on the side of the box. And every time the ball moves within the box, you hit that button. And when the button is hit, you get the feelings and all of the emotions that flood back from the day that you lost that person, with all of the pain that comes with that, and the tragedy, especially if it's sudden or even if it's not, it's still very difficult. And over time, through counseling, through therapy, and just by the nature of time itself, that ball gets smaller and smaller, but every once in a while, it'll always circle back and hit that button inside the box. And so when it first happens, the ball is huge and it's constantly pressing up against that button. But then after a while, the ball starts to shrink and you start to be able to cope with things better, to deal with things, and with in conjunction with therapy, books, other people that have lost a loved one and have gone through grief themselves, and know what the process is like, can help you. But it does get better. But I would say, from just I don't think it ever truly does go away. It can't go away because that person who meant so much to you is always with you, no matter what. So, and it's a good thing, as Jan was saying.
That one says,
So I do have Google nonstop.
stop Googling.
Why did they? Yeah, stop. No.
Yeah.
I think it's good to Google
Yeah.
some things because to be educated about
Yeah.
your own problems and you can converse things and bring concerns up to doctors that you may or may need. But again, you have to be careful because
You can
every
go
time
down
you
the rabbit
Google,
hole.
yeah,
I did an experiment on myself one time. I had
did an experiment on
well,
yourself.
that sounds weird, but you'll see what I mean in a
Yeah.
minute. I simply had neck pain
Yeah.
one day, and I knew why, because I had lifted something or something like that, and I pulled my neck, and I knew exactly why. So I'm like, well, I just want to pretend that I don't know what's going on, and I'm going to Google it. So I put in, like, why do I have neck pain? And I think I had at least 20 diagnoses pop up before it went to simple muscle strain.
Yeah.
It was like 20th on the list. The
Mhm.
first one is like cancer of your spine. The
Mhm.
second one is like, well, you're going to be paralyzed because you have a tumor pressing.
Yeah,
Like
for sure.
all of these crazy ones before it got to simple muscle strain. So you want to, you want to Google and be knowledgeable of your own symptoms and what may be going on and bring that to your doctor's attention so that they can help you say, like, well, yeah, it's probably not a tumor. It's probably the muscle strain. But you want to be careful getting like stuck down that rabbit hole where you're going to just give yourself so much anxiety and not be able to sleep and, search for what could be going on. So be careful with like Googling too much and take it for what it is and look for the horses, not the zebra, if that makes sense.
Exactly. And it's hard too because if you don't have a lot of medical background or someone that you know very well that has medical background, you can take things in isolation and read one sentence out of context and it may mean something completely different than what it actually is saying. And so it's really important to, even if you do think you may have this or you may read about this, is to talk with it about with someone who knows what they're talking about that can kind of break it down for you.
Which is why we're here.
Yeah, that's right. That's the whole point of the videos and the website and everything,
your videos.
guys, is to make medicine both and health in general fun, entertaining, but also educational. So you learn as much as you need to know without getting bogged by the details that are irrelevant that we have to know.
Yeah.
So unpopular opinion did say, what was the question? Why do they say days 5 to 10 are the days to watch for COVID? What do you mean days 5 to 10 are the days to watch for COVID? Like to watch when it's
after
ending?
exposure?
Yeah. Can you clarify that
Yeah,
for
I'm not
us?
sure what you
Popular?
mean.
That would be helpful.
In the meantime, Jamie Kennedy said, I had a brother die from leukemia. We are very sorry about that.
Yeah, it's hard.
Can this run in the family? Also had an uncle die with it. Also, is this just a male cancer?
That's good. Yeah, that's a good question. Leukemia definitely can affect anyone. It's typically a little bit more common in men, but again, there's dozens of types of leukemias depending on what it is and how severe it is and what it affects. But cancers in general, a general rule of thumb is there is a hereditary component. There's some that have a much stronger hereditary components than others.
Like your breast cancer and things like
prostate cancer, breast cancer, a lot of the big ones. Colon cancer is another huge one that is a strong family history. But like anything, like any cancers, they definitely can run in the family. So I think, Jamie, it would be a really good idea to make sure you see your local healthcare provider every year just to get routine blood checks and blood work, because that's something that can be picked up on routine blood work for sure.
Yeah, just make sure you're getting your basic labs done once a year. For anybody that's kind of younger, healthier, you should have a primary doctor and get labs drawn once a year. And then, of course, as you hit some of your milestone ages, like 40, you should get a mammogram, and 50, you should get your colonoscopy. But it depends on your history. If you have a lot of cancers in the family of like breast cancers, colon cancers, then those ages change. So you want to be
Yes.
prepared and make sure you're staying on top of things.
For sure. And guidelines are changing, it seems like every
Yeah.
few years on who should get what, when, and how early should you start. But I would definitely, when you go see your primary care physician, local healthcare provider, no matter who it is, they will be up to date on that and can give you the best guidance on screening protocols and looking for things that maybe in your family or long down those lines, just to keep you healthy. That's our goal.
Yeah. She's female. My younger brother worries about it a lot, and I've worried myself.
Yeah.
Yeah.
Easy to
So,
do.
but it's not a male or female. Like you said, a little more affects males a little bit more, but anybody can get leukemia.
hmm
And like you said, there's different types. You can get it in different age groups too. There's different types that are more predominant in certain age groups. So just, if you and your brother are worried, try not to let it consume you.
Yeah.
But just make a point to get your labs checked every year. And then you're doing everything you can to stay on top of it.
Yep. That's the only control you have.
Yeah, the rest is out of your control.
Yep. Exactly.
So unpopular opinion is back to clarify. I read that days 5 through 10, if you have COVID, that it can take a turn for the worse all of a sudden. Like you could be feeling like you're getting better, but then get worse again.
Okay. That makes
sense.
Yeah, that makes more sense.
Thanks for clarifying.
For sure. Probably not. That's more of like hearsay stuff of what people can say and talk about. Typically, if you have COVID, depending on your underlying conditions, that can make things worse or not. You will have the worst symptoms within the first week of having it. And so after day 10, especially after day five to 10, at that point, you should be getting better. And if you're not, you definitely should go to the ER, go get checked out by your primary care physician, because there could be some underlying cause that's making you worse. So,
and I see that some of this clinically, that people will come in and they'll say, well, I have COVID and I felt bad. And then I was kind of starting to feel better. And then I felt worse again. So clinically, I do see, of course, I'm a small patient population and this is just my perspective, but I do see that patients kind of wax and wane a little bit. But I know a lot of people have anxiety of, well, I felt completely fine on day 10 and then day 20, my friend just dropped dead.
Right.
So they get worried about that kind of stuff. Typically, you're going to feel crappy within the first 5 days, and then it usually goes away, gets better and better. But I have had some people say, like, I was feeling so much better, and then boom, worse again. But the other concerning thing to bring up that you should be aware of is especially if you have more of the respiratory symptoms, if you're feeling like you're a lot better, and then suddenly you're like, I'm very short of breath. It's really hard to breathe. My heart rate's very high. You can develop blood clots after COVID. Yep. It can cause your blood to kind of thicken up and send blood clots into your lungs. So if you do have that where you suddenly get worse, just get in and get checked out if you're concerned.
Absolutely. It's the best thing you can do.
I think Henrietta was answering back to David.
Yeah.
That some years can be worse than the first year. I lost my 48-year-old son in 2015. Sorry, I'm not good with this phone. That's okay.
We appreciate it.
You're just trying to help him.
Yeah.
Thanks
for the comment, because it's hard, and really only someone who's gone through the grief process in losing a loved one can really empathize the best with those others who've done the same. So we appreciate it. Well, it's almost dinner time.
Yeah, we have pasta to go eat.
But seriously, guys, thank you so much for tuning in, as always, with everything. For those of you who weren't here earlier in the stream, I will link Jan's YouTube page, Instagram, everything down in the description, also in the comment section, so you can go back and view it. And for whoever else is viewing this that's not a part of the actual live stream, will see it as well. I just want to give a quick
Thank you.
Yeah, Jamie, you're
Thank
welcome.
you.
You're welcome, everyone. Thank
Unpopular
you
opinion,
for
thank you.
for being here with us. I will be posting
Thanks, Laura.
probably twice a week, 2 to 3 times a week, depending on the schedule and just life stuff in the future. But Sundays and Fridays for sure, kind of around the same time in the morning. So be sure to check out those videos. Be sure to check out Jan's stuff on her Instagram, YouTube, Shorts. I know you've been posting and then getting into posting more videos. So follow her for really good content for everything and many different topics. Blow up her inbox with questions. She loves getting them too.
And if I can't get to your questions, I'll write them down and we can do another live.
Yeah.
If I'm sure that Mitchell will put out a poll for you guys and see if you liked the live, if you want another live. And I can kind of keep track of some questions that are coming in on my Instagram side of things.
Yeah, should be awesome for sure.
So.
And I do not have Instagram or TikTok or any of that fun stuff.
Loser.
They're trying to get me on it. Might happen at some point, but for sure, if you're on Instagram, TikTok, follow her for more good content, for more not only learning but fun stuff, entertaining, getting to know her as a person too, because she's awesome and I love her. And so I know it's sappy on the end of the stream.
We're getting the cheers again.
Yeah,
my Instagram is, he'll link everything, but it's Ask Dr. Rice.
I'll type it in the chat. That's it in the chat. And then I'll put the actual link in the description so you can just click on it. It'll take you right to her page. That way you can follow her too.
And I'll try to keep going with some fun videos.
Yes.
And a lot of times in my Instagram stories, I'll just have an Ask Me Anything box and you can put your questions in there. And if I don't get to them in my Instagram stories or by making a reel or something like that, we'll filter them for another live, or I'll give them to Mitchell to make his videos.
Sure.
You know, lots of ways to get your questions in. And I just thank you guys so much for coming. Thank you, Mitchell, for having me on here.
Yeah.
I just had a really good time interacting with everybody, and you had great questions, and I loved doing this. So hopefully we will do it again. We appreciate everybody being here.
For sure. So thank you guys again. We'll see you next time. Bye.
Bye. That was so good.